In March of '99, in an issue of Good Housekeeping, he was selected as one of the top breast cancer surgeons in the country. In January of 2000, he became the proud recipient of the Healing Hands Professional Merits Award. It's a community initiative that honors those who dedicate their life to the care of the sick. And in 2011, he was also awarded the Healthcare Heroes Lifetime Achievement Award from the Tampa Bay Business Journal. He has been governor at large for the American College of Surgeons and past president for the Florida chapter of American College of Surgeons. So as you can hear, he has quite the expertise. He's going to be sharing with you tonight about the genetic components of a lot of these diseases, breast cancer included. So I'd like to welcome Dr. Charles Cox.
Hopefully you have some information that will help each of you. I was fortunate enough early this morning to see the program that Nancy Snyderman did on Today's Show, and it was very enlightening. And I think something that it was very unique in the sense that it talks about the whole genome, our whole genome, and all of the diseases that can be passed down through our genes, just as we have red hair that turns gray like mine and brown hair that turns white like others. Those are all patterned genetic events in our lives. And so it's important to understand how important genes are to our lives and to our ultimate outcome from disease. Well, there's also the genes you wear. And to not confuse the two, the genes you wear were actually developed after World War II and evolved from a popular rebel teen wear, standard dress of the hippies in the 60s. In the 70s brought about a revolution in style and fabric treatments, and so now you can get jeans that are really pretty comfortable instead of those old, kind of stiff ones, you used to have to break in. In the 80s, they saw a rise in designer status, and for a while the U.S. was quite popular. Everybody was trying to get a hold of Levi jeans all around the world. Today, jeans transcend age and socioeconomic style barriers, can be worn in with virtually anything, anywhere, by anyone. And now, if only it wasn't so difficult to find the perfect pair. Well, what is genetics? They aren't your genes that you wear. It's a whole thing that you are born with. Your body is going into those genes and is determined by another type of gene. The key is this is found in your family medical history and genetic makeup. Genetics is a study of genes and heredity, and that investigates the way genes influence our individual traits, including our health. And why is it important to know about your genes? Well, almost every disease is influenced in part by your genetic makeup. Heredity is a risk factor for disease. Nearly all diseases have a genetic component that is inherited, a result of environmental factors and behavioral and lifestyle factors such as exercise, and we'll talk about those things. So by knowing your unique genetic risk profile, you can take action by making healthy lifestyle choices, partnering with your physician to monitor your health and work out a plan to minimize the impact of your inherited risks are critical. So for those people who have cardiac risks in their family, they might want to be put on something to lower their cholesterol, and that may help. So again, the basic units of heredity are genes, a section of the DNA that determines the inheritance of particular traits, and they're located on the chromosomes of the cell nucleus. You have more than 20,000 genes, and DNA sequencing is 99.9% the same in all people. So it's just a very small fraction that makes the big differences in each of us. So again, that's what our genes do. The Human Genome Project was interesting. A 13-year international research effort was done with the cost of over $3 billion to look at all of the base pairs that create the human genome. Base pairs are like, if any of you remember the movie Gattaca, it was a whole thing, talked about the different pairs of nucleotides that make up the human genes and the DNA structure. And again, those 20 to 25,000 genes were analyzed, and that work was completed in 2003 in that Human Genome Project. And that had a project, and it allows us as researchers to identify the blueprint for building a person and their health. So again, we're finally getting to the real rudiments of what causes disease. And it's been a very exciting time just in my lifetime to see the dramatic changes that have occurred. I would say when I started medical school, probably 95% of all of the diseases, we had no idea what the cause was. And to some degree, we still don't. And yet we get up and claim we have all of this new technology, all this new information, and so people's expectation is very high that we should know everything there is to know about your disease. But very few of the diseases do we actually really know the cause of and really how to treat. So I think it's important when you go to your doctor and partner with him that you realize, yeah, he's a smart fellow or she's a smart gal. They know what they're doing, but they don't know everything yet. And we're still learning quite a bit. As a matter of fact, the medical knowledge is exponentially growing now at a rate of almost doubling every 2 to 3 years. Used to be about 7 to 10 years when I started medical school, and it's gone up and up and up. Now it's just the publications and everything about medicine and anything to do with the human body is just exponentially growing at a very rapid rate. So there's lots of stuff being discovered every day. So much so most physicians can't keep up with it and narrow their fields to very small areas just so they can keep up with a very small part of what's being discovered. But let's look closer at the chromosomes. Each cell contains 46 chromosomes. You all remember that from biology. 23 from each parent are paired together. There's 22 autosomes, some that are responsible for non-sex characteristics, and one pair that's responsible for the sex chromosomes for female or males. Again, do you know what the following disorders and disease have in common? All of these diseases are defined by a genetic problem. So sickle cell anemia, hemophilia, ovarian cancer, colon cancer, breast cancer, cystic fibrosis, type 1 diabetes, deafness, glaucoma, Rett syndrome, asthma in males, or male pattern baldness, and Marfan syndrome, and epilepsy. And that's just a few. I mean, there's a whole bunch more, but these are ones we all are pretty familiar with. Many of us know what they are or know about them. So most diseases have their roots in genes, and 3 major groups of genetic disease include single gene disorders, chromosomal disorders, or multifactorial or complex disorders. And the single gene mutations are present in cystic fibrosis, hemophilia, and muscular dystrophy. So there are thousands of single gene diseases. These are 3 that you're also familiar with. Usually follow a straightforward, predictable pattern of inheritance. So, again, if your mother has it, you might inherit it. If your father has it, if you both have it, you definitely are going to get it. Those kinds of things. So it's kind of like the rudimentary things we learned about genetic inheritance in our grade school and in college. Understanding these patterns will help determine your inherited risk and the risk of passing it on. So again, if, for example, a BRCA gene, we know that it's not just whether your mother had breast cancer. It's whether your father's family had breast cancer. And your father may have the gene and may never get breast cancer. As a matter of fact, a man can have the gene positive, and only 4% of the men who have the breast cancer gene will get breast cancer. As compared to, as we heard earlier, possibly up to 87% of the women who have breast cancer gene positive will get breast cancer in their 70-year lifespan. So even though you have the gene, it doesn't necessarily mean because of the other environmental hormonal factors that occur in women make it a much more lethal problem. But it doesn't mean you can't have that passed on through your father's side. So it's an important thing to understand the genetic history on both sides of the family. And a lot of people say, oh, my mom didn't have breast cancer, I'm fine. No. And also, because my mom didn't have breast cancer, I'm fine. No. Because 80%, 85, 90% of the women that come in don't have any family history of breast cancer. And yet, they're sitting here with a breast cancer diagnosis. So again, don't be confused that genetic things are the only be-all. You still got to come get your mammogram, okay? Still got to be checked. But understanding these patterns can kind of help, and you can talk to genetics counselor when you have diseases that run in the family so that they can help you guide your life and help get you through so that you won't have as many problems or risks of getting that disorder. Again, cause mutations that can affect people are on our sort of chromosomal structures. We all know of Down syndrome and other similar to that, Turner syndrome, but those are both chromosomal disorders that occur in the division of cells and happen with some frequency in the population, but aren't really inherited. They're inherited because they occur at the time of a mutation during the development of that single child, but they aren't necessarily passed on. Again, multifactorial disorders are the result of a combination of genetic and non-genetic causes. So for example, you may have a risk factor for high cholesterol, but if you watch your diet and eat right, don't, have bad behaviors, don't eat at McDonald's every day, then, you might make it, so if you change your behaviors, you might actually end up doing well, even though you have a clearly inherited problem. So again, we can help prevent multifactorial disorders, which include life-threatening and debilitating diseases such as cancer and heart disease, which are most common threats to our health. Again, common multifactorial disorders are diabetes type 1, heart disease, which we've mentioned, some cancers, including breast cancer, pancreatic cancer, colon cancer. All of these things have to do with, can be modified by diet and exercise and other things, which we'll talk about as well. Again, genes are inherited, so are certain lifestyles and habits. You probably act just like your mom and dad did. Maybe you didn't, maybe you don't. But again, the diets we eat, the stress factors, whether we smoke, whether we use alcohol, some of those things are learned behaviors. And again, our physical activity. Are we good role models for our children? Do we engage in these kind of bad behaviors that might potentially cause problems for our children in the future, or do we actually try to live a healthy lifestyle and avoid alcohol and smoking and try to reduce our stress and take time off and do things that are healthy for us? So those are things we can teach our children as well. So again, the diagnosis of genetic disease includes, of course, a physical exam, mainly a history, right? A history of the whole genetic piece of your family. And again, clinical and laboratory genetic tests and a complete review, like we said, of the whole family history, the generation of aunts and uncles, nieces, and so forth. And some of us don't really take time to figure that out, or, oh yeah, we don't have anything in our family, and all of a sudden you get a breast cancer diagnosis and you start asking questions, and finally you find out, oh yeah, Aunt Mary did die of breast cancer, and oh yeah, and Aunt Susie, they had colon cancer, and a few of them had ovarian cancer. Well, what did she had? Some kind of some kind of gynecologic cancer. We don't know. Oh, well, it was ovarian cancer. Oh, wow, big deal. Makes a big difference. So getting that information is critical. We've had patients come in and say, oh no, I don't have any family history, and then go back and research it and come back and say, oh yeah, by the way, I need to get tested because, hey, my, so-and-so had ovarian cancer and breast cancer and early ages and things that I didn't even know and realize. So it's important to do a little bit of your genealogy work so you can find that information out. Again, there are 3 different types of genetic tests. There's cytogenic types of tests, which is examination of the whole chromosome. There's so they just look at chromosomes, and then there's biochemical tests, meaning examinations of proteins that are created by the different genes. And then there's the molecular type, which is a direct DNA test, like a BRCA test. So genetic tests can be used to predict the risk of disease, like the BRCA1 and 2 genes, and confirm the diagnosis or monitor the prognosis for newborn screening or carrier testing. So even in your sons, if you may have had a breast cancer, they may need to be tested eventually, see if they're carriers or if they're going to pass it on to their daughters. So that's an important thing. I have a colleague who I work with today whose mother had breast cancer, and so he brought her to me to have her breast surgery, which I did. And at the time, it was many years ago now, but it was before the BRCA test was released as a test. And so the Myriad company was, at that point, putting together a study trying to find what the incidence was of breast cancer gene positivity in patients recently diagnosed with breast cancer. And so they offered the test free to anybody who wanted to take it who'd been recently diagnosed with breast cancer. And so he knew about that and immediately took her over and had her tested. Turns out she was positive. Not only was she positive, he was. Not only wasn't he positive, but two of his sisters were. So we ended up operating on his two sisters and his mother, and of course we didn't operate on him, but the reality is he's got 3 sons, and so he probably isn't going to have any effect of that gene in his generation, of his family. But those sons could all, or some of them, half of them, would be carriers. Okay, and so they need to know that to whether they pass that on. So again, it's important that you partner with your doctor and get recommended tests, and again, just a good history and physical exam, standard things that we've talked about, mammograms, colonoscopies, all kinds of checking your skin, make sure you don't have any melanoma or moles or anything that's abnormal, checking your cholesterol levels and your EKG, all of these things. And I put here the fasting blood glucose is a test, but the A1C test is actually a more accurate test of your overall glucose levels long term. And can I suppress bad genes to reduce my risk? Risk is a likelihood or chance or possibility or probability. Again, by adopting and following healthy lifestyles and habits, you can reduce your risk. So let's use these following gene reminders. We'll talk about genes. Straight leg genes. We know about straight leg genes. Well, straight leg genes. Let this be a reminder that to point you straight to your physician's office and start and stay on top of your genetic health. Okay, get regular and complete exams and make sure you have your screening tests on a timely fashion, and an early detection, as we found just from mammography that we just heard about, can save your life. And discuss your family and medical history and share concerns and questions that you have. We know about low-rise genes. Okay, so rise to the challenge and maintain a healthy weight. I'm working on it. Lower your weight if necessary, and your goal, no more than 20 pounds outside your healthy weight. And belly fat especially is harmful. So I'm in deep trouble, but I'm working on it. I got up and did my 40 minutes of exercise this morning, 30 to keep myself healthy and 10 to get rid of my weight. So I think that's a critical part of everyone's thing, and I think it's important for me to do that to show my children who are older now, and that's an important part of their life and lifestyle as well. Well, flare leg genes. Put up some flair in your diet. Go natural. Go colorful. Add different fruits, veggies, every meal. Top salads and with nuts and seeds, and include legumes and soups and stews. And choose whole grains and low-fat dairy and lean meats and fish. And please avoid the drive-thrus. Lifestyle habits, the boot cut. Think boot camp, okay, and get moving. Stop smoking. Reduce your alcohol intake, and lights out early with adequate sleep. So those are all some things that we can do for our own little boot camp. Relax fit. That's kind of where we need to say more. Relax and reduce stress. Make time each day for calming things down, and meditate and read an article in a book, listen to your favorite music, go for a nature walk, and enjoy a massage. Do things for you. Nobody's going to help you but yourself. And so I think, that's what I see in a lot of women's lives, is just as was pointed out earlier, when women take a lot of time and effort to care for everybody else, but that they really take the time and effort to care for themselves. Remember, you can't care for somebody else unless you're there, and you can't be there unless you're healthy and well. So take time to take care of yourself. Now, overalls. Overall, activate your life. Active hobbies, gardening, household project, chores. Overall, these are great forms of exercise. So think about that when you think about overalls. These are some startling and important facts for you to understand. This is one that I tell my patients almost. Anyone who now comes into my office gets this little talk right here. And that's 30 minutes of walking a day. And it doesn't have to be harder than that. The studies that were done show that if you walk 30 minutes a day, just walking, you will reduce your risk of breast cancer by 30%, colon cancer by 30%, if you're a man, prostate cancer by 30%. So drag your husband along with you. You'll reduce your risk if you've had breast cancer, and I know there's a few of you here who have because I've treated some of you. You'll reduce that risk of recurrence by 70% just by exercising no more than 30 minutes of walking a day. You know, most people can get on a pair of shoes and most people can find a place to walk 30 minutes. So it's not like you got to join a gym or you got to do something miraculous. You just have to get out and get going and do it. So that I would encourage you to do. That's also 30 minutes of walking a day is equivalent to an antidepressant. So if you're feeling a little low, get out and start walking. It'll help. So all these things are very critical to your health. And it was very interesting in the studies they did. They found that the people who didn't do at least 30 minutes of walking a day got no improvement, no benefit from it. But if you walked 30 minutes a day, you got the benefit. If you did more, you know, Zumba and crazy went nuts and wow, you know, then you got no more benefit. So it didn't matter. It's kind of it's a very standard concept in medical health care. It's called the dose of a drug is enough. Okay, this happens to be 30 minutes of walking is the dose of this drug that affects our lives. So again, it doesn't have to be more, it doesn't have to be crazy, it just has to be 30 minutes of walking, but it has to be every day. So again, that's the critical piece, is the constancy and the consistency of it. You know, get a dog, I don't know, something. So you gotta go out and walk them every day. Do something so you go out and do some walking, you know. But that's my recommendation to you is it's just 30 minutes of walking a day. Get yourself in the habit and you'll be much improved in lots and lots of ways, physically, emotionally, mentally. Okay? So although you can't change your genes, there's much we can do to wear them and the best health possible, and the choice is yours. Again, we now know about breast cancer epidemiology, and back in 1963 it was 1 in 18, in 2012 it's 1 in 8. What happened? What's the difference? Well, an increasing incidence in the under 55-year-olds is occurring. Clearly, the baby boomer wave the age wave of people in the baby boomer age is coming through. And there's a dramatic increase, as I'm showing you here, from 1985 when I was in practice till today. Now in 2020, there's going to be as many as 420,000 breast cancers a year in this country. And so it's accelerating, but it's accelerating because there's so many people my age and older, because the baby boomers that are coming through are basically increasing their risk of cancers, all types of cancer. So electing a healthy lifestyle is a critical part of keeping you from being in my office, okay? I don't wish my services on anybody, but I'm sure glad I'm here when they need me. As we said, 87% risk by age 70 if you have the gene positive. 26 to 85% risk of ovarian cancer if you're BRCA1 positive, and 10% if you're BRCA2 positive. And again, the BRCA2 is more common in males. It's also seen in the Ashkenazi Jewish population. And again, there's other familial types of breast cancer. So it doesn't mean, I have one family, for example, they had 8 daughters, 7 of them have had breast cancer, but none of them have the gene. Okay, so it's a familial disorder. There's some other complex arrangement of genes in their family that makes them at risk for breast cancer that isn't carried out by these BRCA1 and 2 genes. So there's stuff we still obviously don't know about this, And so it's important. In any given family, anyone would inherit it only at a 50% rate, so the 7 out of 8 would be entirely impossible to have the gene positive and have that be the cause. So again, there are familial disorders, and so it's important to know your family history. And these are some of the references this information was drawn from, and I want to thank you for the opportunity to speak with you tonight, and hopefully it hasn't been too boring. But so what did you learn that you have to do? You have to do, and you can all do it. 30 minutes of walking a day. And you can break it up. You can do you can do a little 30 minutes of something else, but it has to be that same 30 minutes every day. So I ride my bike every day, get on my little stationary bike and put on my earphones and rock out for 30 minutes. So, and if I can do it, you can do it. I'm a busy man, so I understand, and I know it's hard to get taken care of, but you have to take care of yourself. If I don't take care of me, I can't take care of you.